Hey, this is DocShay and welcome back. Today, we're talking about Class 4 or warm laser therapy. A lot of people are familiar with light therapies. It's a big thing. You're hearing about red light therapy here, whole body red light therapy, cold laser therapy. Well, warm laser therapy is fairly new to the industry, and it is delivered at so much higher wattage. It is such a great product now over what we've had in the past. Other products we've had in the past are good, but we've made some technological advancements with this warm laser therapy, and we can deliver up to 45 watts, 5 to 6 centimeters deep into the tissue, where cold laser and even red light therapy is less than cold laser. We can deliver a half of a watt or less, about 2 centimeters deep into the tissue. So when you're talking 5 centimeters or 6 centimeters deep in a tissue, that's the difference between getting to a shoulder capsule, maybe getting to a facet joint in the spine, as opposed to just treating the muscle. What all do we use warm laser therapy for? Many things. The nanometers, the wavelengths are measured in nanometers, and this warm laser therapy has 3 main nanometer wavelengths. It's a tri-wavelength device. It's from Aspen Lasers, and it's just fantastic. The first nanometer is in that anywhere from 600 to 800 range, and that's that more red light therapy stimulating the mitochondria, and that stimulates increased oxygen in the tissue, which helps with our healing. The next wavelength is around the 800, really the 900 meter wavelength, really helps drive inflammation, and again, continues to speed healing. The other third wavelength goes to about the 1064 wavelength. And that wavelength specifically targets the C nerve fiber. That is a pain sensing nerve fiber in our bodies and can help block pain immediately. So what are we doing with warm laser therapy? We're increasing oxygenation and healing in the tissue. We are decreasing inflammation and speeding the healing in the tissue. And we are blocking pain in the tissue and in the joints. So it really has a profound effect, especially when you add them on top of each other, which most light therapies are used for. Safety is another big concern. Light therapy is relatively safe for most people. There are some things we don't want to, put over certain devices like a defibrillator or, some of those devices. But this warm laser therapy is very safe for implants, spinal implants, hip implants, knee implants, a screw in the wrist that you broke skateboarding when you were a kid. Any of those things, it's very, very safe for. We have patients with neurostimulators in their spines, and we can do this light therapy over the leads very safely. So there's a lot of benefits for warm laser therapy, especially the amount of improvement that we can have is shown through research is vastly different than just what we've had in the past in most therapies. Again, we're using these in all of our high-end athletic training facilities. There's a reason they're using that. Speed of healing things that we just couldn't get to before. So if you're interested in finding more about the Aspen or any warm laser therapy, the Class 4 warm laser therapy, visit our site at DocShay.com. There's plenty of information about that and other things. And just come by and see us. Give us a visit. We'll be glad to go over it with you then.